presenting a new series Medically Verbal where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 22. Chief complaint. A 65-year-old female patient presents with shortness of breath and swelling in her legs. History of present illness. The patient reports experiencing progressively worsening shortness of breath over past 2 weeks. She finds it difficult to breathe, especially when lying flat, and has to use multiple pillows to sleep comfortably. She also notes swelling in her ankles and lower legs that has been increasing in severity. She denies chest pain, fever, or cough. Past medical history: hypertension, type 2 diabetes mellitus, chronic kidney disease stage 3. Medications: lisinopril for hypertension, metformin for diabetes, atorvastatin for hyperlipidemia. Social history: non-smoker, occasional alcohol user. Family history: father had heart failure. Physical examination: BP is 150 systolic, 90 diastolic, heart rate 90, respiratory rate 20, temperature 37. She is using accessory muscles to breathe. A cardiovascular region shows jugular venous distension, presence of S3 heart sound, peripheral edema, which is pitting in nature, present in the lower extremities. Respiratory region shows bibasilar crackles on auscultation. Abdomen presents as non-tender with no hepatomegaly. Initial differential diagnosis: congestive heart failure, chronic kidney disease exacerbation, pulmonary embolism, chronic obstructive pulmonary disease exacerbation, anemia. Based on this presentation, what do you consider the most likely diagnosis, and what further investigations or management steps would you recommend? Okay, so based on the key findings and the chief complaint, this one is a bit tough to solve out. Let's look at the key findings first. She is suffering with orthopnea. How can we say that there is progressive shortness of breath, especially when she is in a particular position, that is, when she is lying flat? She is also experiencing paroxysmal nocturnal dyspnea. Why? Because when she is saying that she is using multiple pillows to sleep comfortably. Why do pillows help? So, paroxysmal nocturnal dyspnea is similar to orthopnea, but the term nocturnal indicates that this is something which is happening usually at night when the person is sleeping. So, what happens is, when the person is sitting upright, the person is able to breathe properly, there is no shortness of breath. But once the person is lying down completely flat, they feel restless, they feel shortness of breath. Using multiple pillows as a headrest gives them a more elevation over their neck region, providing the body with the feeling that it's still upright. So they do sleep in a not so flat position, but at the end they're able to sleep comfortably. Swelling in the ankles and lower legs is indicative of pitting edema. Then there is jugular venous distension, and presence of S3 heart sound is an indication of heart failure. Bibasilar crackles on auscultation. Crackles usually occur when there is a fluid buildup over the lungs region. Bibasilar means at the base of the lungs. So this particular symptom or key finding is indicative of pulmonary congestion. When we accumulate all of these key findings along with her complaints, the most likely diagnosis is congestive heart failure. We're going to confirm it out. We'll run the laboratory tests like PNP, which is B-type natriuretic peptide. The elevated levels are indicative of heart failure. How? Whenever the heart fails, they are not able to produce the level of ANP, because of which the brain starts producing more level of BNP, which is brain natriuretic peptide, because the brain definitely cannot handle a fluid overload, which the patient is currently suffering from as well. That is indicative in her swellings. We'll perform a complete blood count to check for anemia or infection. We'll perform a whole renal panel test like checking for electrolytes, blood, urea, nitrogen, creatinine, so that we could check out for any electrolyte balances. We'll perform liver function tests to check for liver congestion, because that is something which could happen post heart failure. We'll do the thyroid function test. Now, how does thyroid hormones affect in heart failure? Basically, thyroid hormones exert an effect on the heart muscles for a regular rhythm to work out. Yes, our heart has orthorhythmicity, but in excess of thyroid hormones can exert strain on the heart muscles because the pumping is getting increased. For imaging, we'll perform a chest x-ray so that we could check out cardiomegaly and pulmonary congestion. We'll perform an echocardiogram to check for the cardiac structures and functions, at the same time checking out the ejection fraction and valve abnormalities. We'll perform other tests, electrocardiogram, to see for ischemic changes, arrhythmia, or left ventricular hypertrophy. For management, we would put them on diuretics so that the fluid overload could be decreased, and we'll put them on oxygen therapy when the patient is hypoxemic. For long-term management, we'll give the patient ACE inhibitors so that the afterload could be reduced and the cardiac output could be improved. We'll provide them with beta blockers like carvedilol to reduce the heart's workload and improve survival. We'll provide them with aldosterone antagonists like spironolactone so that we could further reduce fluid retentions and improve outcomes. We'll ask them to modify their lifestyle by restricting sodium in their diet. At the same time, we'll monitor their weight and we'll ask them to stop smoking. Now, why do we give ACE inhibitors? In a lot of my videos, I've already told you that we'll give ACE inhibitors like lisinopril or beta blockers. So ACE stands for angiotensin converting enzyme. This is an enzyme which is released by the lungs and it converts angiotensin 1 to angiotensin 2. This is a procedure which occurs whenever you want to activate the RAS system, then in angiotensin aldosterone system. This is done whenever we want to retain water in your body and we want to keep the water in your body. Now, because there is already a fluid overload, there's already, let's say, an electrolytes overload because of which the fluid retention is taking place, we have to make sure that this enzyme in particular is not working up to its normal limit until the situation hasn't been subsided, until the disease hasn't been subsided. So we give them with ACE inhibitors so as to there is no conversion of angiotensin 1 to angiotensin 2 and the RAS mechanism cannot take place, because in heart failure, anti-natriuretic peptide is something which is not being able to release. So the feedback system for RAS to stop doesn't work out, because of which the whole body tends to have fluid overload at various places that leads to swelling. By beta blockers, because heart has beta adrenergic receptors which responds very well to catecholamines. Now, if our heart is already in a state where it's not able to work well, to stimulate it with catecholamines is something which would be a death sentence. So we would prevent by just blocking the receptor itself. No amount of adrenal or noradrenaline can, put it into use. But aldosterone antagonistic same to get against the RAS mechanism. Once you get against the RAS mechanism, there won't be any fluid retention in the body and the fluid overload situation would be subsided very quickly. Now, why do we get swelling in heart failure? Like I've already told you, this covers a lot, but if I just say it in a nutshell, swelling in this case is primarily due to fluid retention, which is caused by the compensatory mechanisms activated in response to the heart's decreased ability to pump blood effectively. This compensatory mechanism is activated because of the kidneys. These mechanisms lead to increased blood volume and venous pressure, causing fluid to leak into the interstitial spaces, which results in edema. Effective management of heart failure includes strategies to reduce fluid overload and alleviate the symptoms of congestion. Directions or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.